and welcome to Nursing You. I am Lisa Blake, and Nursing You is all about nursing. And you are all welcome to come in, whether you are a nurse, whether you are in support of a nurse, or whether or not sorry, I'm just going to make this little adjustment. Sorry about that. Or whether you are just interested in some of the topics that we discuss. Today is going to be awesome because I'm talking to you about nursing jobs away from the bedside. So, nursing jobs away from the bedside are actually available in plenty right now. There are plenty of options for you. I will say that you do increase your options if you are a registered nurse as opposed to an ADN. It's the honest truth. You do increase your options if you are a bachelor's prepared nurse as opposed to being an ADN. But opportunities still abound for you. So I want you to pay attention and listen up to what we have going on here. So one of the jobs that are available. Sorry, just looking at my notes because I want to make sure I give it all to you. Is a telehealth nurse. So, for example, you'll find that these individuals are maybe working for companies, pharmaceutical companies like a CVS type place, where they have an urgent care, and they will utilize a telehealth nurse in that capacity. So that's an option for you. Telephone triage. I happen to be a nurse manager for a multi-site call center where we utilize triage nurses, and so that is an option for you as well. And I just have to put this in here because I think that people really don't understand how important triage nurses are, and maybe I'm biased, but I think people make an assumption, oh, it's easy, you're just waiting by the phone, but really, and I have seen people who have made the leap from an ED nurse, an emergency department nurse, or an ICU nurse, and they will tell you that triage nursing is not what you think it is, because you do have a set of protocols in place. You maybe even have a program, but it is absolutely vital that you get the information that is needed, because that patient is going to be all over the place, and they will sometimes lead you down a primrose path. They'll say, oh, I have a cough, and oh, it's not bad, and completely leave out that they're spitting up blood, or completely leave out the fact that they have a toe that's about to fall off. So it is up to you to guide that conversation in a professional and authoritative way in order to get what you need from the patient that is on the other line. So enough about that. Another role that you may want to consider is nurse educator. So there are a lot of even a diverse amount of roles, a variety of roles, even within nurse educator. You could be a nurse diabetic educator, and maybe you're providing education for diabetic patients on behalf of the hospital. Maybe you're not associated with one unit in particular, or maybe you are that nurse educator that's on the unit. Maybe you provide education for cardiac nurses or for dialysis nurses. These roles are very important. I will say that you have to really do your homework with these roles, because sometimes it will require you to have a certain degree of patient contact in terms of having an assignment. So you really have to do your education. You really have to get educated and do your research on what the role is really entails, and see if there's a patient assignment component to that. And also look around. If you're thinking about being a nurse educator, what I would recommend to you to do is to look around and see what the infrastructure is on that unit. For example, if they're down nurses, or if they don't have any leadership, down a nurse manager, if they don't have an assistant manager, you want to look at that, because that means that you may be filling in for any one of those roles. So you want to really ask questions in your interview for nurse educator. And also, you sometimes a nurse educator position is kind of organic, because you're a shining star on the unit. You're awesome and amazing. Always keep your education and your training up to date and updated. Always looking at journal articles regarding cardiac care and post-cath care and things like that. And so maybe you just become the educator by virtue of organically. But there may be a situation also, if you're not in that scenario, where they're requiring a master's degree or additional certification. So you'll want to know that as well. The quality team. So I had the awesome and amazing opportunity to to work for the quality team on a temporary basis. And the quality team is excellent depending on your facility. You may be putting in, writing policy and putting those things in place on how to handle not just coronavirus, but other issues as well. And so you may be looking at, the PPE and how that's being handled on a facility-wide basis, or how it's dealt with in terms of if you have an emergency outbreak, your outbreak procedures, your emergency procedures. So quality nursing can be very interesting. You have to like spreadsheets and data and things like that, or that's really not going to be your cup of tea. So just think about that with quality. Clinical research nurse. So this is the nurse that accompanies, that is part of the research team. And really what you're doing is you're providing patient care and a certain amount of clinical expertise when it comes to the patients that are involved in a particular study. So if that's something that interests you, you have to think about reading, again, data, and writing is going to be a big component of your job, as well as with quality team nursing. But those are just some of the options that are available, usually still inside of that acute care setting, at that facility, that maybe you might want to take a look at to see if there's anything that interests you in particular. So be vigilant. Look at your job boards and investigate. If there's something that you're like, wow, that seems interesting, investigate it. See if there's an opportunity. Here's a bonus tip. See if there's an opportunity to shadow that person. That if you have a diabetic educator, to see if you can kind of shadow them for a couple of hours, maybe outside of your shift, to see if that's something that you think might be a good fit. So I hope you have liked this content today. And I just invite you to share this video with someone that you think will benefit from the content. I invite you to subscribe, like, and share the content, and hit that notification bell so you'll be aware of more videos coming. I try to post on Saturdays, just once a week, so it's not gonna, it's not gonna just crowd your inbox with those notifications. But you have a wonderful day, and I'll see you later in another video.